Hello everyone, my name is Eric Nichols. Wanted to do a quick video called how to eliminate or reduce your Medicare Part B premium. My name is Eric, like I said, Nichols. I've been in insurance for 28 years. And just a little bit about my background before I get started. I've worked at Forethought Annuity Company, one of the largest annuity companies in the United States. So I do help a lot of my clients when they go to retire, roll over old 401ks or CDs. From there, I worked at Genworth Long-Term Care, the oldest long-term care company in the United States. So if you do have questions on long-term care, short-term care, I can help you there. And I've been helping seniors and veterans for just over 28 years, specialized in Medicare, life insurance, Medicare supplements. But one of the most common questions I get is there a way to reduce my Part B premium that I have to pay when I go onto Medicare? Or is there a way to reduce it? I see all these ads and commercials and they say you get money back. So I wanted to do a quick video to help you understand. At the end, I am going to share a link that you can review your own Medicare during annual enrollment, or if you're turning 65, as well as a link to schedule an appointment. I can spend 5 minutes to show you how to walk through doing it yourself, or ask me and I can share some time with you and we can help find the best plan for you. So the first thing I'd like to do is how to eliminate your Part B. In 2025, which is what we are now, the Part B premium is $185 a month. One of the problems is in January 2026, it is going to go to $206.50 a month. So just over $20 a month, which is a big increase. And a lot of seniors are nervous. We're all on fixed incomes. I hear all the times, Eric, what am I going to do? I can't afford this. Every time I get a Social Security increase, my Medicare goes up. So first, we want to review the 4 ways to eliminate your Part B premium. I've helped 3 people this week that were unaware. And that is based on, if you can see in the screen, if you qualify for Medicaid. Now, a couple things you need to learn there are 4 different ways to qualify for Medicaid. You don't have to completely be broke. So the first way is what's called full dual eligible. So when you turn 65, it is a completely different Medicaid than when you're under 65. So when you turn 65 and over, it's called Medicare, Medicaid. It's dual eligible. If you are single and you make $967 as of 2025, and these are 2025 numbers, or if you are a couple and make $1,450 or less, and you have single, if you have less than $2,000 of assets, so CDs, checking account, savings account, if you're a couple, $3,000, you could go ahead and you can apply for Medicaid. And if you are approved, it's going to pay your Part A, your Part B, so that $185 is going to be paid, but it also is going to pay nursing home, assisted living, and your copays and deductibles and medical cost share. So that is pretty much if you just are living on Social Security, you don't get a pension, or if you get a small one, you make less than that. So that's a fraction of my people. But then you have a lot of the United States is kind of middle class. And what that is there's what's called QMB. So if you are single and you make $1,325, or if you're a couple and you make $1,783, but now your assets change. Now if you have $96.60 in your checking and savings, or if you're a couple and have $14,000, $14,470, then what happens is you still qualify for full-blown Medicaid. Your Part A and Part B are going to be covered. So again, you don't pay the $185. And again, your medical deductibles. So for Medicare, your co-insurance, your co-pays, those are going to be covered as well. So that's qualifying for QMB. And that's big because there is a lot of my seniors that make $1,250 a month. I have couples that maybe make $980 and your spouse makes $700, so you make less. Again, you qualify. And today I had one of my seniors call me and he said, Eric, you're right. He was 71 years old. He said, I didn't know all this time. I've been broke, worried, nervous. I applied, and somehow it took him about 7 days, and he got the letter that he's been approved for QMB. Now, your other way to eliminate your Part B is called SLMB, SLMB. And all that means is your income goes up a little bit. So you're not broke on Medicaid, you're a little bit above broke. But SLMB is if you make less than 1,585 if you're single, 2,135 if you're a couple, and it's the same 9660 if you're single, assets 14,470 if you're a couple. Now this is a big one because I do have a lot of my veterans and a lot of my seniors that maybe make $1,500, $1,550, and they're getting by, but they're still struggling. And so your benefit, they don't know. They've probably called and they've asked if they qualify for Medicaid, and they were told no. And that's because a lot of states you have to apply separately, meaning that when you call and ask if you qualify for Medicaid, they're all assuming you mean full dual Medicaid, 967. I know, like, for example, Indiana. Indiana, if you apply for Medicaid and you're denied, then people think they're done. Well, there's not. There's another application to apply for QMB, SLMB, or Q1. And that goes under SMP, or MSP, sorry, Medical Savings Program. Sorry about that. And what that does, again, is that's for people that make above Medicaid, but you're still on a fixed income. You're blue collar, basically. Now, if you qualify for SLMB, and even if you look at the couple, it's 2,135. I have a lot of my seniors, a lot of my veterans. They're making $1,100 a month, and their spouse is making $980 a month, and they think, well, we don't qualify. Well, that's untrue. Now, if you do qualify for SLMB, again, you're eliminating your Part B. What it will do is your Part A is free, your Part B, that $185, is paid for. Your copays and deductibles, you are responsible for. But again, we can eliminate that 185, and again, we're getting close to 2026. When that goes to 206.50, that is a big premium to pay for Medicare. And if we can go ahead and you make $1,550 if you're single, let's say, and if we can get you applied and you qualify for SLMB, as long as I take away that $206, that is a big life changer. Because again, if you make $1,550 and all of a sudden Medicare's taking $200, you're down to $1,300 to live on. And there is one other option. It's called Q1, and that is for people, again, that make a little bit more than SLMB. I have a lot of clients that fall under Q1. And Q1 is if you're single and make less than $1,781, or if you are a couple and you make $2,400 or less. Again, it's still the same 9,600 assets or 14,000 assets couple. Checking account, savings account, CDs, investments. But the reality is a lot of my blue collar seniors and veterans, they may have $8,000, $9,000 in an account, or maybe $3,500 in a checking and $5,000 in a savings. And they make $1,700, $1,680, and they think, well, I make too much for Medicaid. And again, that is not true. They would make too much for full dual Medicaid, but if you qualified for the Part B to be eliminated, that's a big game changer. Okay? So these are the 4 ways to eliminate. You would just basically call your state Medicaid office and ask them. And again, I would go based on these numbers. So if you do call and you kind of see this chart and you know where you fit, if you ever call for assistance, you would say, I make $1,200 and I want to see how I can apply for QMB. Or I make $1,490. I need someone to help me apply for SLMB. You can do it online or you can make a phone call and take care of it there. Every state is different. So you always want to call your state Medicaid office or your Social Security, and they can guide you to help get this taken care of. So that is the first way that you're going to eliminate all of your benefits. And again, if you need to talk about programs that we can put you in and things like that, I can send you a link and I can tell you how to do it yourself. or with over 28 years of experience, I'm going to give you my information. Just give me a call or send me an email. Schedule a time for me to meet. We'll spend 5 or 10 minutes and I can give you some guidance. Because a lot of times, much like the gentleman today I talked to, Ray, and he called and he said, Eric, I don't ever really trust anyone. You seem like you knew a lot. I did exactly what you said. I got the letter today and I've been approved for QMB. And he was ecstatic. He's like, Eric, I make $1,300 a month. I'm 71 years old. I've struggled. I've been scared and nervous my whole life of, am I going to run out of food or am I going to run out of housing? What am I going to do in the wintertime? And it was just a great feeling to hear him. And he said, I wish there was a video. So Ray, I'm making this video for you, buddy, so I can reach out to more people. Now, if you don't qualify for this, let me slide this up. So let's say you make too much money and you say, well, Eric, what if I don't qualify? Or me and my wife, we both make, $1,400 and we get a little bit of a pension. So we're over that amount. And I have a lot of members there blue collar. Their Social Security, again, maybe $1,300. But the problem is they're getting a small pension of maybe $690. So it puts them over even Q1. And what happens there is you can actually qualify for what's called a Part B premium reduction or a Part B give back, a Part B reimbursement. So it's got a lot of names. But let me explain to you kind of about that because you see a lot of ads on Facebook. You hear friends that are saying, oh, I'm getting $185 or I only pay $20 for Medicare. And no one understands how that. So I want to explain that to you here. So what is a Part B give back? So a Part B give back, also Part B rebate, is when some Medicare Advantage plans, and that's called Part C. So I have seniors, veterans that are confused and they say, well, I don't want to buy insurance or I don't want to buy a Medicare Advantage. There's no purchasing. Medicare, most of your Medicare Advantage are zero premium, and a Medicare Advantage is Medicare Part C. Years ago, there was only Medicare A and B. The government knew there was 10,000 people turning 65 a day. They wanted to design a new Medicare, so they called all the giant insurance companies and we said, we want you to design a new Medicare. We're going to call it Part C, and it has to be equal or better than Part A and B combined. And when you guys are going to get bonuses and you're going to qualify for bids, the extra money that Medicare is going to give these insurance companies, they can add dental, vision, hearing, a gym membership, over the counter, and a Part B give back. So it's not a sales pitch. I just want to help you understand it. So on Medicare Advantage, some of them offer reduced monthly Part B premium give backs. So in 2026, the maximum is $185. If you were in 2025, which is where we're at this year, it was $174.70. They did increase it. And it depends, you guys, by the county you live in. And I'm going to explain that to you. Not everyone gets the 185, but that's just based on where you live. So what CMS does, right here you can tell, is they adjust the amount of your Social Security check. Or if you're paying monthly or quarterly, they will reduce it. Now, you still have to pay the difference. So what I mean by that, let's just say this year, if it's 206 and you qualified in your county for $185 back, the difference is $21. You would still be responsible for $21 a month of your Part B premium. So if you're receiving Social Security, they're only going to take $21 a month out of your Social Security, not the whole 206. If you're getting a monthly bill, it's just basically going to be reduced by that. And monthly bill is called Easy Pay. That is when they draft it out of your bank account. Or if it's quarterly, you would receive it. So again, $185, if you're only responsible for $21 for a quarter, every quarter you would just pay $63 and that's it. So why do different carriers charge different amounts? So that's a big common question. I'll have a lot of my clients say, hey, I talked to my brother, he lives in Tennessee, he gets $185 back. And I live in Springfield, Illinois, and I'm only getting $100 back. And we're both on Humana. What's the deal, Eric? Again, it's based on the zip code and the county you live in. Every zip code, every county is bid on by the insurance carriers to Medicare. They then will receive amounts of money they can use however they want. Some carriers will give $185 back, but less dental, maybe only $1,000 of dental. Other carriers may say, well, we're not going to give any Part B back, but we're going to offer $4,000 of dental and $350 of vision. So that's why every year you want to compare what's important to you. If you have a lot of dental work, then we want to compare and find a plan that offers the most dental. If you don't have a lot or you only go to a couple specialists, we want to look for that Part B give back. And here's how it works. Under your number one, Medicare Advantage plans, every carrier submits bids to CMS based on how much they think the cost is for a standard senior in each county. If they get the bid and it's below the benchmark for the senior in the national United States of what the CMS thinks it would be, then they're going to earn a rebate, a portion of the difference. And those plans can use that rebate, which is money back to the insurance, however they want. So they can use the money they get back from CMS to offer more dental or offer vision or reduce your premium or give you a give back. And so that's why there's so many different plans, because they put bids in every county on what they think it is going to cost to take care of a senior in Sangamon County in Springfield, Illinois. And they're going to say, we think it's going to cost X dollars to take care of a senior this year in Sangamon County. Well, if that is below the national standards per CMS, then they're going to get a bonus given to them, and they can use that bonus however they want. If it's in a different area, let's say it's DeKalb County. I'm just using Illinois. And let's say, well, it's going to cost us more money to take care of seniors in this county. That's why you're going to have less dental, less vision, less give back. Because if the insurance companies say it's going to cost us more than what Medicare thinks, they may not get bonused. And that insurance company may say it's not worth it. So they're either going to stick with the plan or they will completely pull out of the area. That's why you'll hear people say, hey, I had Cigna and now it's gone. Maybe the national amount for that zip code went up. A lot of people were sick in your county. And it just cost more, so it's based on that. The next is the amount available for extras, including givebacks. So again, that depends on the bid. You take the benchmark, how the insurance company, and they decide what they want to do with the money. So that is just why I put some counties are 185, and that same carrier and the same plan in a different county is less. So it's always a trade-off what they want to do. And one of the things that I'm going to show you on a link I can send you, but one of the things I tell people is on average, when you look at an ambulance on most of your carriers, it's anywhere from $150 to $350 per ambulance visit. An outpatient surgery might be $250 to $500 for outpatient. A hospital visit could be anywhere from $150 to $495 a day, days 1 through 7. Then you're talking rehab. You know, if you have to have rehab, a lot of plans are $25 to $40 a visit. Well, if you're having rehab 3 times a week, that can get costly. So if you look down here, one of the most important things, and again, reach out to me. I can send you a quote based on the plan you're in, but there's a rider called the Advantage Plus rider. And from 65 to 75, it's guaranteed issue. No health questions asked in most states. Some are 65 to 70. But the benefit of this rider, and I'm just going to ballpark, I just helped someone who was 65 the other day. We covered their ambulance, so it was a $300 ambulance. We made that copay $0 with the rider. The outpatient surgery was $395. We gave them $500, so it actually made that $0, and they made a little money to help. The rehab was $50 for 30 visits the first month, which far exceeded them going every single day if they had to, and it more than enough covered the rehab visits. When we looked at that, you take a look, we made the ambulance $0, we made the outpatient surgery $0, we made the rehab $0, as well as we covered their hospital. I believe the hospital in that one was like $375 a day for 6 days, which can get costly. So we went ahead and covered that. And I believe that whole rider was about $35 a month, maybe 40 a month. So when I was talking to the client, I said, listen, we just put you on a give back that's giving $150 a month. So I'm like, every month, your plan is going to give you $150. So what I recommend is why don't we add this Advantage Plus rider? It costs $40 a month. And when your plan gives you $150 back into your Social Security check every month, let's use 40 of that, and that will add the rider. So now, in theory, you're getting $110 back every month. And on top of that, if you go into you take an ambulance, if you're in the hospital, if you have rehab, if you outpatient surgery, all of those copays will be paid for. You'll get a check, it's reimbursed and covered. And the benefit is we also can add skilled nursing. So most plans, skilled nursing is about $183 a day to $213 a day, days 21 to 100, which can get costly. But we can add it for about another $15 to $20 a month. We can make that zero. So if you think about it, most plans primary care is zero. So if we can make your primary zero, we can make your ambulance zero, your hospital zero, your outpatient surgery zero, and your skilled nursing, you now have an incredible plan. And again, to add that rider complete is about anywhere from 30 to maybe 50 a month. That's why I like to tell my clients, let's look with a plan with a Part B give back. Let's use that give back to add the rider. So basically your carrier's paying, and the difference of the money will help reduce your premium. So with that client at $150, they added a rider to cover the zero. They still were getting $110 back. And remember, Medicare is $185. So $185, even minus the $110, they're only paying $75 a month for Medicare. So you definitely want to ask me when you call about the Advantage Plus. Even if you don't change plans, whatever carrier you're on, I can send you and just give you a quote, a chance to look at that. So now what I'd like to do is when you watch this again, there's a link to book an appointment. You can email, you can call me, and what I can do is I can go ahead and I can send you a link and you can compare all the plans yourself for annual enrollment. Let me show you what you'll get when I send that to you, and I'll give you a quick demo on how to use it. Okay, so the first thing you do is if you guys were going to want a link, you just ask me to send you a link. There's no charge, nothing is attached. So I'm going to put in here my zip code where I live, 19425. I'm going to put my name, okay, Eric, oh, sorry. So if you email me your zip code and you email me your name, I can go ahead, okay, and I can send you a link, and it says compare plans. So if you look in my area, there are 49 plans available. So 32 of them include prescription drugs. So if you are a senior, you want to look at these plans. If you are a veteran that uses the VA and gets your medicines from the VA, if you are on TRICARE for life, which includes your prescriptions, you're going to want these plans right here, and that's because these plans do not include prescriptions. That's because you're getting your medicine from the VA or you're on TRICARE for life. You retired from the VA or you were injured. So if you're a civilian senior that did not serve in the military, don't click that box. You want to click this one right here. Now, if you're a veteran, again, you can choose either. So if you want to get prescriptions outside of the VA, you can use this plan also. So what you're going to do when you send me that, you're going to get something like this. I'm going to show you. And all I'm going to do is you'll see all of these plans pop up. So every carrier that's in your area, United, Aetna, Humana, WellCare, HealthSpring, Devoted, all of the carriers are going to be included. What I'm going to do is I'm going to just click one of these and I'm going to send you a quote. Okay? So I'm going to send this quote to you. I'm going to send it to either your phone or your email. So I'm going to put my email in here. Okay? And I'm going to send the quote to me. It just got sent over to me. So I will show you what it looks like in your email. Give me a minute. So we're going to go to my email real quick. And if you notice, I don't have anything new. So always check, because this is a secure link. Check your spam. So I'm going to go to spam. There it is. So because this is a secure link, we got to take it out of spam. Here's the link saying, and if it goes to your email without spam, you're just going to click this. But mine went to spam. You're going to hit show image right here, and then you got to check it is not spam. And that's because, again, it has secured links. Then you go to your inbox, and give me a second here. There it is. It just popped up top. So all you're going to do is you're going to go here when you get the link. It'll say, hello, what your name is. We're going to send that to you. Here's my information. Here's my email and my cell phone if you want to talk to me. You're going to just click get quote. It is going to circulate that it's going to send you a code. So if you give me your cell phone also, I can send the code to your cell phone, which is easier. But we're going to hit send code. We're going to come back over here. We're going to hit enter. And we are going to, let me hit refresh here and see if we can get this code real quick. And I believe I already got the code earlier. So let me pull the code up and put it in. Okay, there we go. Then when you get it, you're going to get this. And we're not going to worry about this quote I sent you. I can send you 3 quotes. And they will be the best Part B reimbursement, so you don't have to do all the legwork. But if you'd like to see everyone, you're going to go up here to the right corner, see around here where it says personalize your benefits. Click that. And if you see this, I have Part B. If you wanted to add dental or whatever, you could add other things to look at. So we update it. And then you come over to filter. And here's everything you can filter by. Okay. And we want to go down here, and you want to go right here. If you want to filter by dental, you can. If you'd like to go by hearing or vision. But we want to look for Part B. That's the most important thing. So we're going to click on Part B. We're going to go down, and you're going to hit apply. And now it just knocked all of those plans that there's only 9 plans with drugs that have Part B give back, and there's 13 veteran plans. If you want to see if you're on a Medicare supplement, you can compare drug plans. But if you're on an Advantage, do not look at this box. This is only for people on supplements. And again, this is a pretty big one. Look, there right there is 9 and 13 with Part B reduction. Watch this. If I get rid of that, there's actually 82 plans. This is going to take you forever to look into. And a lot of agents, if you talk to them online, don't want to research that, so they might just pick 1 or 2 they like for you. So I'm trying to teach you. I'm going to send you this link. You can do all this yourself. Or call me and I can walk through much easier. After 28 years, it's seconds. So we go there. Now what we can do is, again, 9 plans. I can look through all of these plans if I want and compare. So Aetna has a plan with the give back. United has a plan. Some of the carriers, just so you know, are not paying commissions to agents anymore. So they may not even tell you that this is an option. But here you can compare. So you can do 3 at a time. We pick 3. You hit compare. And then what happens is right here, it's going to show you. So we can look right here. We can go here, and this is a 0 deductible. Now your max out-of-pocket, a lot of people are worried about that. One is if you added the Advantage Plus rider, you're never going to have to worry about it because those copays are paid for you and they add up. I'm going to explain this in a minute, but here you go. So a doctor visit is 0 with all 3 plans. A specialist, 55, 50, and 45. Skilled nursing, this is why I was saying. But if you look, $218 a day, days 21 to 100, which is very common. Then your home health is 0. And all I'm doing is comparing plans. Okay. Emergency room, $115. Hospital, $555 a day, days 1 through 4. $388 days 1 through 7. 450 days 1 through 5. Again, this is why you add that rider. If not, when you're wondering about max out of pocket, let's pick one. These are about 9,000. For you to hit that, you would have to go into the hospital. If you look here, it's about $2,200 for 4 days. Anything over that's free. You would have to go in for a week, come back out. Go back in for a week, come back out. You'd have to do that 4 times. And then when you've done that and you've spent about 9,000, everything is free after that. But I have a lot of people ask about the max out of pocket. And again, on that max out of pocket, it's kind of hard to hit. But what we want to do is we want to go down, and here's the give back I was telling you. So it's $60 with United. Aetna's giving $44 back, and Humana is giving $90 back. So what you would do is you would scroll back up. You're going to hit previous because we want to see what the other plans. So again, we're going to come down here. We're going to uncheck that one, uncheck that one, uncheck that one. We're going to look at the next 3. So here's one, there's one, and there's one. And this is why it takes so long when you're talking to agents. So then what we're going to do here, we're going to wait because I want you to see all the different comparisons. We'll scroll down. And Part B, this one is giving $175 back, Cigna. This is only $1, that's $110. So right now I know the 2 best givebacks are this Cigna HealthSpring, which is given $175. This Humana is $110. So we're going to scroll back up. We're going to write on a piece of paper, this Cigna Preferred Savings, one of the best plans. We're going to scroll down again. We're going to uncheck that one. We're going to go to the next, uncheck that one. We're going to go to the next, and down here, we're on the very last one. There's a Highmark. Sorry, there was an Independence we missed, and we missed a Devoted. Oh, I already got 3. Let me, there we go. Let's go back up here. And we'll go to Devoted. So you're just going to do this. You're going to compare all 3. And again, this is all an agent's doing, so it is time consuming. But we're going to go down here again. And now you're going to see that Devoted is given $184.70 back. So then what I would do is I would go back. And it's a lot of work, you guys. That's why you're better just to call me and let me pick the best 3 if you want and tell you to save you time. But out of the 9 plans, then what we're going to do is we're going to look through these and we're going to say Devoted was one of the best ones. And that's Cigna. So we're going to find that Cigna HealthSpring. We're going to compare plans. And now this is what we do as agents. This is what you can do by yourself. Oh, we can take that Highmark out. Now I know these are the 2 best givebacks. So I'm just going to go through them. And I'm going to say, okay, they look to have about the same max out of pocket. Doctor is 0 with both of them. Devoted is $50. Cigna's $45, so it's $5 cheaper. When we look, $218 a day for skilled nursing, that's the same. Home health care, outpatient, ER. Hospital is different, $475 days 1 through 4, $390. So again, Cigna's winning a little bit, but look at the Part B. Part B is $184.70 a month versus $175. So again, if you're wanting to get the most Part B reduction, if you went ahead and added this to cart, you could actually enroll in Devoted yourself without an agent, and you're going to get let's call it 185. Well, remember Medicare is going to 206 in January. If you got 185, you would pay $21 for Medicare. So out of your Social Security deduction, it would only be $21. If you wanted to go with Cigna, it's going to be $31. So you can look at that. If you want to look at your drugs, you scroll down. Here's your generic. They're the same. There's that. So there's your Tier 3 is 22% with Devoted. Tier 3 is $47. But this is how you would compare plans. And then if you want to enroll, you click Add to Cart. and it comes up and you're just going to go ahead and apply. It's very simple. You would just click virtual right there. Now, real quick, I want to go back because if you are a veteran, I want you to see the difference of the plans also. So a veteran, again, you're going to click there. Remember, this is if you use the VA for your medicines or if you are on TRICARE for life. If you are on TRICARE for life, you can only look at plans that are PPOs. See where this says PPO? That's it. So if you were on TRICARE for life and we went back to the plan with drugs, you still can get it, okay? But here's the problem. When we look at that Cigna plan, Devoted's a PPO. If you're on TRICARE for life, you're fine. If you enrolled in the HMO and you are on TRICARE for life, here's what happens. TRICARE for life works like a supplement. It covers copays that Medicare doesn't. The problem is, with an HMO, you have to see a doctor in network, a civilian doctor. If you want to go to a specialist, that doctor has to refer you, and HMOs are by counties. So if you are in Cook County in Illinois, and you drive maybe 4 minutes east, and all of a sudden you're in DuPage County, well, the problem is that plan is not in the HMO network because it's only for the county. So what that means is when you go in and give them your Cigna card, they're going to say, oh, you're out of network. We only cover Cook County. So your Advantage plan's not going to cover it, which is your Medicare. If they don't cover it, TRICARE doesn't cover it. So the number one rule, if you have TRICARE for life, you can only look at PPOs, okay? Again, let's say you go on this and you are a veteran using the VA for drugs. The benefit here is you would have drug coverage outside of the VA if you went to civilian doctors, okay? But we want to go back just quickly. If you are a veteran, you're going to click the middle one, and you're just going to compare again. I won't keep boring you with it. It's very competitive. You're just going to do the same thing. Pick 1, 2, 3, hit compare. Go to the next one. United, go to the next one. Independence, go to the next one. Humana. And again, you're going to hit compare. You're going to look at the 3. Very simple. You can email me. You can click on Calendary. Here's the 3 plans. I go down, and this one's giving $18. This one's giving nothing, and this is $160. You're just going to keep doing that. Now, the difference is, this is why it's worth 5 minutes of time with me. Okay, let me show you. As an agent, I have what's called Medicare Link. So I'm going to go in here. You guys are going to tell me your zip code, 19425. I'm going to go over here, okay? And mine looks a little different than yours. I basically click on Part B, but now I don't have to go in and out, in and out, in and out. Look right here. I have every single Part B give back. $175, $184, $110, $1, $60, $90. You just want to keep looking, $44. So this $90. So I can tell you as a veteran, hey, I already know what 2 plans. Now what can do here is if you call me, I can either do this and review it with you, or if you say, Eric, I've got that link that you sent me. I don't want to look through everything. Can you just tell me? I would tell you like you saw. Yes, you want to go ahead and click on that Devoted. I would click on that HealthSpring. And you know what? You might want to check with Jefferson. So you're going to pick those 3. You could look on your end, and I can look on mine and say, okay, Devoted is 184. Cigna HealthSpring is 175, and Jefferson is 140. If you're a veteran, you really care about getting the most money back because you're using the VA for everything. So I would tell you to pick the Devoted PPO to get the $184 reimbursement because you're using the VA for everything. Let's say you're on TRICARE. Could you use and go on the HealthSpring? Absolutely not. It's an HMO. That is another reason. If you're on TRICARE, it's probably worth calling me to make sure that we protect your TRICARE coverage. But if you're a veteran, we basically look at these 2, and then we just go down. All you do is you're going to scroll down, and you're going to see copays. Devoted gives $150 for a Fitbit or an Apple Watch. Cigna doesn't. An ambulance is $350 or $230. One important thing, if you're a veteran, as long as you go to the VA once every 2 years, you're active. If you go into the hospital, if you take an ambulance, as long as you call the VA within 72 hours, they are going to pay that. But if you haven't been to the VA in 2 years, you're going to pay it. We go down, chiropractic 15. Dental, that's an important thing. Cigna's given 700, Devoted's given 250. That's not a big deal. We go down more, but if you look, over here they're giving 2,200. So if you're a vet and dental's important, you might be willing to get a little less money back every month, but you're going to have $2,200 of dental. So you're just going to scroll through the copays. They're very simple. You go side item across. You go down. Here's your hearing. Outpatient surgery. So very easy. If you had outpatient surgery, remember I told you $575, $425, $400. So you're good there. Over the counter, this one gives $91, nothing, $30. So if you go down, this just keeps telling you vision, $200. This plan gives you just an eye exam. This one's $200. So you now have a comparison. So based on the copays, Devoted looks to be a little bit more on some of the copays, but they're giving you $185. Remember at the beginning we talked about CMS giving them a rebate money to spend? What the Devoted said was, hey, let's give our seniors more money back every month to do what they want. Let's give them that $185 and they can use it to pay copays. They can use it to add a rider and keep the difference. Or if they're healthy, it just reduces their Medicare premium. Instead of $206, we're going to give them $185. They're not going to spend it on copays because they're healthy, and they're only paying $21 a month for Medicare. But again, you go through here. Here's the hospital. Again, Devoted's a little more. But again, as a veteran, as long as you call the VA within 72 hours, they're going to pay the ambulance and the hospital. So at least go to the VA once every 2 years to check in. If you got questions about the VA, call me. I'm a specialist with the veterans also. But again, if you looked at this as a civilian, a senior who's not the VA, the problem is if you pick one of these veteran plans that does not include prescription drugs, you're kind of in a pickle. And the reason I say that is because if you pick a plan that does not include prescriptions, you will start getting a 1% penalty per month. So you definitely want to pick a plan that includes prescriptions. But again, I want to show you how much faster this is. Let's say you live in Arizona, 85260. You call me up. Watch how much, it's just going to save you time. I'm going to send you the link. You can do everything yourself. But you can say, Eric, what's the Part B give back? I'll pull this up if we're on the phone. And I will say, okay, HealthSpring's got $10. HealthSpring's got $110. There's $1. They've got one with $90, $2. Ooh, this Devoted is $184. I think that's one you should look at. This HealthSpring's got $185. I think that's another one. $2 one, $74, $84, and $127. So I would probably compare the three largest ones. So I compared the three largest. All I'm going to do is tell you to go to that link I sent you unless you want me to help you. If not, I'm going to say, okay, go to that link that you had, and I'm just going to show you. So it's Devoted, HealthSpring, and Alignment. Again, there's the comparisons right there. I'm going to tell you, and all you would do, 19, okay, is you're going to, if you have this, you're literally just going to say, oh, okay, Eric, what do I do? And let me correct this. Okay, so instead of doing the filter and chasing all the plans down, all that's going to happen is I'm going to tell you, okay, go on there. You're going to scroll down until you find the Alignment Smart, the Cigna Preferred Savings, and the Devoted Plan 19. So you will go down and you'll scroll down till you find it, and you'll say, well, let me look, and I'll stay on the phone with you. You're going to keep pulling down, and you're just going to go until you say, oh, you know what? I found it. Click. Then you're going to go to the HealthSpring one, and you're going to say, hold on, I'm looking. And you'll just keep going down. I'll stay on the phone with you. and you'll say, hold on, oh, I found it, okay? So you're gonna click there, okay? There we go. And then you're just gonna hit compare. You and I will stay on the phone if you want. I'll make sure they pop up. You'll say, okay, Eric, it's working. Give me a minute. It is going to pop up for you. There we go. So there's your 3 comparisons. You'll be able to go just like I said. You'll compare them here. And you'll say, okay, Eric, I see it. Cigna is 185, Devoted is 147, Alignment. So you'll just be able to compare all the copays, and if you decide you want to enroll, you can enroll in yourself. If you said, well, I like Cigna, I want to learn more, you just hit Plan Details, and now it's going to dive even deeper into all of your cost. So you will sit here and be able to look at every single copay that you would be responsible for. And again, I would call or ask if you do pick one, just call and say, Eric, can you give me a free quote? This is the plan I went, and I can send you that Advantage Plus rider. So I do hope this helped you. Again, it's worth getting the link. You can review it by yourself. Is it worth doing it by yourself? I think you can do it, but I think if you call me for 5 minutes and let me do the heavy lifting, I can pick out the 3 plans quickly and let you know, hey, you know what? Things to look for. Go down. Yes, you're in Devoted. You want to check the over-the-counter. They're giving $140. The other 2 aren't giving anything. So, wow, Devoted's giving you $185 and $140 every 3 months to spend at CVS. Vision, wow, they're giving $400. The other 2 are $100. So I might give you those tips and say, hey, based on that, you may want to dive in a little bit more to that Devoted plan. It has better over-the-counter. It's got the max Part B reimbursement. It's got the best vision. Just compare copays. And again, if you go on this plan, and some people may say, well, Eric, the specialist is a little more money. It's $55, and these others are, that one's $20. You guys, who cares? They're giving you $185 a month. You can use your $185, and if you go see a specialist, pay it, and you still have $130 extra to help pay copays. That's where some of my seniors get confused, is they'll say, well, an Advantage plan has copays. Yes, but if you're on an Advantage plan with copays, and either one, you add the Advantage Plus rider, and it pays the majority of copays, or you decide to use that money every month, and when you do have a copay, use it, you're ahead. So I hope this helped. I am in the description below going to add a link for the GTO rider. I did a video on that, but I hope this helps. At the end of this video, I'm going to have my email, my phone number, a link to schedule appointments. So please feel free to reach out, schedule it, share this with friends and family or other friends. If at the end it doesn't say Eric Nichols and you see Andrew, Jose, Linda, Rick, Kyle, I'm going to tell them just to put partnership with Eric Nichols. These are representatives. All of the reps that have worked with me have well over 10 years of experience each. I have 28 and a half years of experience. So you can't go wrong. I hope this video helps. Just ask for us to send you the link. You can either go along with us at the same time on your end, or again, now you've seen this, you know how we can help you compare. Just give us a call. We can do it on our end and help you enroll as well. Thank you. Have a blessed day, and I hope this video has been helpful. Thank you.